Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today I'm here with the Chief Product Officer of Happify Health, Keren Zimmerman. How are you today?
Hi, thank you for having me, Jared. Nice to meet you.
Absolutely. I'm excited for us to chat, and I think we should dive right into things. This is the second episode. We've had someone from the Happify Health team on. So I'm excited to dive into some things more, different areas of the company, right? You're very big at this point.
Correct.
So you and I today are going to talk about really some of your core focuses. If we could start with your background, I know the audience would appreciate that, and then we'll talk about recently launched product.
Sounds good. Keren Zimmerman. I'm based out of New York. Joined Happify a year and a half ago as chief product. I joined as the head of direct to consumer, and I focused my energy on building Kopa, which we will talk about today. A few weeks ago, I shifted into a new role, which is chief product officer, taking the responsibility of all the product catalog of Happify and working towards connecting all of them to a platform. In my background, 20 plus years of product work around e-com and direct-to-consumer applications. Prior to Happify, I founded my own company in the space of AI, of incentive personalization using AI, helping retailers and brands to save their marketing budgets. That's it. It's good to be here.
I was using our new recording software. I would have done the applause button when you announced your new role, but that might have spooked you too because it kind of comes out of nowhere. So thank you for that intro. Super helpful. We don't have to go into the ins and outs of Happify. We have the last episode, and anyone does a basic search of your company, they're going to come up with a million different things too. For those that aren't already familiar with you, what I want to talk about today is I want to dive into more about the new product you recently launched and some different parts that you recently launched with it. Kopa, is that the correct pronunciation?
That is correct. Yes.
Can you tell us what that is? Talk through the recent launch and what can everyone that's kind of following it expect?
Would love to. We launched Kopa. Kopa is a care delivery platform and a community app which targets specific chronic conditions that have a comorbidity of mental health. We're looking, and when we built Kopa, we were looking at the approach of a whole person approach. There's a huge problem outside of treating, specifically in chronic condition, treating the physical aspect and neglecting the mental health. And we believe that if you want to help the patient to improve their quality of life, you need to treat all the aspects of their health. Through Kopa, we have a community, as I said earlier. We have supports by peer-to-peer supports of people that are experiencing the same condition and the same exact symptoms that you suffer from, and you can talk about that with them freely. There's expert support in the platform. We have different types of physician and clinician and dietitian and others that supports the platform. They're not giving recommendation, but they're helping by answering questions, providing tips and information that exist, and being there for the community. In addition to that, we're developing tools that are specific to the chronic condition we support. Those tools are a result of user surveys and needs that comes from the community itself, as well as the physicians that works with us. And I'll talk about it in a second when we'll talk about the chronic conditions that we're supporting at the moment. We curate our own content. So the content is written by our own writers and edited on Happify platform. And the principle behind that content is that it's medically approved, but it's written in an approachable way in short amount of portion that help people actually learn more about their condition. But I think the main and the key feature that we have behind the scene is our personalization engine, which understand based on what the members are telling us, where they are in the patient journey. And based on that, we are personalizing the experience, showing them the right conversation and the right content and the right tool that fits exactly where they are in the patient journey.
Super helpful, Keren. So thank you so much for going through that with us. One other thing that you and I really wanted to touch upon today, and this is still related to Kopa, was, and you talked a little bit about this, and we talked about this a little bit before, but what made Happify decide to focus on women in midlife in particular?
So before we jump into that, I'm going to go one step backwards. The first chronic condition we launched we support is psoriasis. We launched that a year ago. That was our test community, which we wanted to see how the members are reacting and what are the features that they're connecting to. And we've seen a great success in psoriasis. We are, for months now, the #1 app in Google Play and in App Store when you search for psoriasis. We have very high NPS score, 73, which it's extremely high for specifically for health applications. And we have tons of users that joining our platform on a daily basis, and we became recently the exclusive community for National Psoriasis Foundation. So when we saw the initial success with the psoriasis community, we figured that if we're driving that help there, let's try and look for areas that are bigger, that they have a bigger need. And women in midlife, targeting women that are going through perimenopause and menopause, felt to us like there's a huge need out there, and there's not enough solutions that help those women to openly speak about what they're going through in this chapter in life. 80% of those women, by the way, suffer from symptoms that are impacting the quality of their life. So how can we help them using content, using tools, directing them to other products on Happify and help them to improve their health? And our AI platform, basically based on what we know on the users, can actually create a precision care process that helps them to tackle the challenges that they have in the current specific moment of their life.
And you answered this already a little bit, but I'll just ask it just in case anything was missed. My next question was going to be what other specific areas are addressed through the platform. So you gave us, was there any that you didn't say in there, or was that pretty much covered at all of them?
That's pretty much covered at all, but the platform that we're building today is actually connected between Kopa and other Happify products. And I think that's one of the advantages that we have in the platform. We are leveraging what we know about the users and our engagement capabilities to actually help healing people in multiple ways.
So as a chief product officer, you have a bunch of things that are kind of on your to-do list on a daily basis, right? That you have to focus in on and make sure that you're executing on. And I'm sure getting out this new product was huge, right? As far as next steps, though, what is that you can speak about? What's on the horizon for some of the other things that I guess users can expect?
So it's hard to talk about them because we cannot share everything, but I do want to tell you that we are aiming to target other large areas where we can bring value to members, areas such as neuro, areas such as cardio. These are coming up in the next months. Ask me in 6 months, I'll be happy to share a little bit more.
I figured. I always like to ask, and sometimes I ask and people say something and I have to cut it out after. So I'm glad you didn't. I'm glad you didn't say anything that you weren't supposed to. Well, it's super exciting, the launch of this new product. I'm sure everyone that's interacting with it is going to absolutely love it. I hope to be able to have you on again in the near future so we can talk about maybe some of the other projects that you are working on, and maybe as they're rolling out, we can have you come back on. Every so often. But yeah, I appreciate you coming on the podcast today, and wish you and the team the best of luck on everything.
Thank you so much. Appreciate that.